before I got into academia, I was working as a psychiatric social worker in New York City. So as a psychiatric social worker, because I was a bilingual psychiatric social worker and I was Asian, I was working a lot with Asian American immigrants. So when I was working with Asian American immigrants, I slowly recognized that there were some distinctive features of Asian Americans. So the features that I discovered were, they tend to have high ambition and high stress, but low resources and low support. So I thought this was very intriguing. And I wanted to find more about why it is. And I wanted to find out more so that I could help my patients better. So I went to the library. There was a pre-Google time. Okay? I feel like I'm so old. So I went to the library. I was like typing in the computers, right? And I couldn't really find anything. I found maybe 3 or 4 articles. That's it. So, oh, this is so pathetic. So I quit my job and I went into the PhD program at Columbia University. So fast forward 15 years, I created an intervention, which Mr. Enping talked about. I created an intervention which is designed to reduce depression, suicidality, and anxiety among Asian American women. All right, so about 2 years ago, my church friend told me that there would be wake service in Newton. So there was a wake service of 15 years old Korean American girl. So I didn't know the family, I didn't know the girl, but I went to the service. And I saw her body. She was the most beautiful person I've ever seen. And besides her body, there was a violin. And I was thinking, and I was hearing all these stories about her, and I learned a lot about her. And she was the exceptional violinist, outstanding student, and a great daughter, and really charming friend of many friends. I left that wake service, and with one single question: why? Why did she make that choice? And that incident really validated that what I was doing, which was trying to discover the risk and protective factors of suicidality, was really valuable for me. So I'm determined to continue to do this research. About 2 months ago, I was invited to meet in one school. So there are Asian American students, boys and girls, all genders. They were chatty, really friendly students. And the school psychologist asked me to talk with the students. So I talked with the students. I had one question. Do you feel pressure? Let's talk about it. When I asked that question, they couldn't stop talking. Pressure, I think for 1 hour, but that discussion lasted for 2 hours. So I came home, I analyzed what I heard, and I analyzed into this context into 4 different topics. The first one was the individual context, and I call it as inner voice trap. So the inner voice traps is an internalized perfectionism. So this student said, I strive for excellence. I feel really bad if I don't meet the expectation. I'm very hard on to myself. And other students said, I never feel good enough. So many outstanding students are here, so it is very hard to stand out. I'm not good enough. And another theme was, my performance defines my self-worth. I am what I achieve. Without my achievement, I will become a failure. So this is an individualized context, and I call it inner voice trap. Yes? Context is a family context. I call it as a family trap. So in general, these students had overwhelming sense of burden. And the first burden was unrealistic expectation over their achievement. My parents don't understand how difficult it is to go to the top universities. They think that if I just study hard, I can get in, but that is not true. I'm already working very hard, but whatever I do, I will never be good enough for my mother. Another theme was emphasizing parents' sacrifice. My parents always talk about how much they sacrificed for us to come to this country and start from nothing. And my parents sacrificed so much for me, and I'm not even sure if I can pay them back. So they also had a sense of the financial burden as well. It's a peer context and social trap. They were worried a lot about whether they can fit in, about the friends groups. And they were also worried about their body image, how attractive they are compared to other adolescents from other racial groups. And really interesting thing was this societal systemic context called as a race trap. So there was racism issues, feeling ashamed about Chinese culture because of how China and Chinese people are being portrayed in the media in the US. And the minority and prejudice concept was that because I'm an Asian, they, meaning that my friends, automatically think that I'm good at math, but bad at sports. But they think that I'm good at math only because I'm Asian. But actually, I put so much time in to be good in math. And the system is unfair. Even if we study so hard, we will be victim of this system. Another student said, I'm an adolescent. I'm not an adult, but this college entrance system expects us to know who we are by now and what the life path we need to take. The last one is I'm an invisible minority. This one woman, one student who was the most visible, most talkative, most intelligent student said, I am invisible in my school. That was pretty shocking for me. When you listen to all these narratives from the students, you can hear a lot of pressure and sense of helplessness as well as burden. But the irony is that even though they have so much burdens, they did not want to burden other people. So they end up suffering alone. So one student said, so I asked the students, okay, so when you have this type of burdens, what do you do? And one student said, doing nothing. Just don't say anything and it'll usually work out. So I wanted to show then what the research showed. Okay, what are the research findings about their mental health status? So these are the depression, the symptoms of depression. You can see from this graph that Asians have the second highest depression symptoms. They're next to Native Americans. They're higher than African Americans, Hispanic, and white. Asian American college students also found that they worry more. Their level of worry is higher than white and higher than African Americans. They also worried about the social interaction. They have a higher level of social interaction anxiety. And this was very interesting. Kazi was like, can you make eye contact? Can you speak in the public? And how do you feel about approaching to other people? And they had more anxiety about those kind of measures. And Asian Americans consider suicide more. So this is one of the study shows that the odds of seriously considering suicide was 1.6 times higher for Asian American college students relative to their white counterparts. And really shocking thing is the Asian American female. So look at this. This shows the all suicide done by all death, okay, along the age between 15 to 24 and age between 24 to 34. So when you look at the Asians, the death caused by suicide was significantly higher than other US female overall population. And you can see that this age between 50 to 24 and 25 to 34, they have a similar trend. Then why is this phenomenon occurring? And what can we do about this? That's the reason why we are here. And number one is why. What's really fascinating is that I was just sharing the two focus group that I had with the high school students, and I analyzed it. But I have worked with more than 1,500 Asian American female students. They are from students as well as people who graduate from college and graduate school students. So age between 18 to 35 years old. And these narratives that I talked about, the individual context, family, and peer, social, and societal context, those are so similar. That was really shocking for me. And why they suffer so much from the depression and they consider suicide so much compared to other ethnic groups is because of those 5 factors that I talked about. They are not just suffering from their inner voice trap, or they are not just suffering from they have just mental health issues or mental health illness, mental illness. Because when you look at other ethnic groups, white and black and Hispanics, mental illness may be the #1 reason why people consider suicide. But for Asians, it was only 1/3 of the times. Okay. And the other 2/3 was because of the social and systematic issues that they are struggling with. So I'm going to talk briefly about my ideas about what we can do about it. Because this mental health and well-being and suicide, this issue is so complex, it is not going to be, we cannot really help by doing just one area, individual approach, or counseling. It has the multiple approaches to improve their mental health issues. So number one, first, before we try to help our students or our children, we have to understand who we are as immigrant parents. What do you mean by that? Let's try to reflect. Who are we as parents? How do we interact with our children? And where are we from? So when we did the survey research, so we interviewed 730 women. And out of 730 women, 40 women, we interviewed them 1 hour to 3 hours. It's an in-depth interview about their upbringing, their parents' relationship, the dynamics, and healthcare utilization, and their depression histories, all the different kind of things. And from that, we actually found that there were some particular women who attempted suicide and who were very depressed. So we analyzed data for 2 years. And after we analyzed data for 2 years, we have discovered there were specific parenting types which were associated with the poor mental health outcomes.